Welcome to AQMD on the Air. I'm your host, Leora Alpern. Our guest today is an expert on the public health impacts of air pollution. He received his Master's in Science in Public Health and Biostatistics after serving as a medic with NATO forces in southern Germany during the Vietnam War. For the past 38 years, he has been part of the Loma Linda University research team, which is evaluating the health effects of long-term exposure to air pollution. He earned his Doctor of Public Health in Epidemiology and is now an associate professor in the Epidemiology and Biostatistics Department, the Epidemiology Program Director for the School of Public Health at Loma Linda University, and served as co-investigator on 2 major epidemiological studies. He has contributed to several publications on ambient concentrations of air pollutants, is a member of AQMD's Environmental Justice Advisory Group, and has partnered with AQMD on numerous occasions by providing his expertise on air quality at AQMD's Air Quality Institutes. Dr. Larry Beeson, thank you for joining us.
Thank you. Pleasure to be with you.
Epidemiology is, in essence, the cornerstone method of public health science on air pollution. Could you explain to our viewers the approach taken in epidemiology and how it makes a difference in learning about the public health impacts from air pollution?
Sure. Epidemiology basically is the basic science of public health. And one of the tenets of epidemiology is that disease is non-random. So the role of the epidemiologist is to look at factors that either increase or decrease the risk of disease. And so another aspect of epidemiology is a comparison group. So we'll have cases compared to non-cases in, say, a case control study, or we might take a prospective cohort study where we take people who are exposed to one level of exposure compared to that of people who live in a different level of exposure. So that comparison allows us to look at what people do that increase the risk of a disease and what do people do that decrease the risk of a disease. And all that is when a study was done that's really doing epidemiology.
Here at the AQMD, the cornerstone of our mission is protecting the public from the harmful health effects of air pollution. You've been a co-investigator in several of the public health studies that have involved the Loma Linda Adventist community. What have the studies focused on, and could you share with us some of your conclusions? Sure.
Well, our first study began in 1977, and it was the study of Seventh-day Adventists in the whole state of California, not just Loma Linda, but all of state California. 2/3, about 6,300 were enrolled. They're all non-smoking adults. 2/3 are in the South Coast Air Basin, where air pollution tends to be high. And then as a comparison group, we have about 20% in the lower air basins, San Diego and San Francisco, and then about a 13% random sample from the rest of California. So we have several, kind of a continuous distribution of air pollution that we're looking at, comparing higher pollution people who live in higher pollution areas to people who live in low air pollution areas. So that study design allows us to look at kind of a dose response on the particulates and the gaseous pollutants and see how that relates to subsequent health effects.
Of course, Loma Linda University is located in the Inland Empire close to San Bernardino. Could you explain to our viewers a little bit about some of the air quality concerns in San Bernardino and the surrounding areas?
Well, the South Coast Air Basin, including the Inland Empire, where Loma Linda is a major thoroughfare and transportation corridor. When goods come into our ports, they get on diesel trains and diesel tractor trailers and go through the major corridor to points eastward. And so that process brings that transportation air pollution through the whole Inland Empire. And so Loma Linda University is interested. We're exposed to that kind of air pollution, and so we're much interested in how can we contribute to understanding the process of air pollution and how can we mitigate the health effects.
I'm glad you brought up transportation, because that is exactly what I'd like to ask you a follow-up question on, and specifically about the rail yards that exist in the San Bernardino area. And AQMD has been working together with Loma Linda University on research that you're involved with. And could you give us a little bit more information about the research that's taking place and also what can be done in the future?
Well, if you look at the 18 or so major rail yards in California, the one in San Bernardino is ranked the highest as far as air pollution. In fact, a state report found that the one in San Bernardino had probably the cancer risk in San Bernardino was probably 2.5 times the next level rail yard in California. So San Bernardino ranks extremely high in terms of the amount of cancer risk that's exposing the people who live nearby. We are essentially, San Bernardino is on one side of the freeway and Loma Linda is on the other side. So when the wind comes down through the pass, we are effectively downstream, downwind of the airports and the rail yards and the freeways. So we're much more concerned about how can we contribute from our expertise. The School of Public Health has several departments. It has the Department of Biostatistics and Epidemiology. It has Environmental and Occupational Health Department. It has Health Education, Health Promotion, as well as other departments. And I envision all of these departments contributing to around the table and in the community with our expertise and our unique abilities to address the health education as far as the health effects of air pollution, as well as other factors that might impact the health of the communities.
You're doing some very important work there, and we've really enjoyed partnering with you. Something new that we're working on now is a program called the Clean Communities Plan, and we're going to focus on two communities. San Bernardino is one of them, and I know you're involved with some of those efforts. Could you share with us a bit of what's involved with that as we develop new methods for reducing air pollutants and air toxics specifically?
Well, San Bernardino is a major thoroughfare, as I mentioned before, and so one of the things that we're doing is looking at how does the effects of doing biomedical research, looking at the people who live near the freeways, near the rail yards, and people who live near both of those, as well as people who live further away that might be more of a comparison group, to see what is the sources of the air pollution, not only the freeways and the diesel trucks, as well as the fixed site smokestacks that are coming out of our industry, and the trains and other kinds of sources that come out, that we would like to be able to investigate that from a biomedical research study that we've been interested in working with AQMD on.
You know, we mentioned earlier some of the work that we're doing together with you, AQMD and Loma Linda, and there's one particular research award that you yourself have received for a study entitled Responding to a Community's Call for Action, studying the health effects of an intermodal rail yard in San Bernardino. So could you tell us a little bit about this specific study? What will be involved, and how will it overall, and the conclusions of it, help us in terms of finding ways to reduce air pollution?
Well, one thing is, you know, this is a 2-year study funded by the AQMD to the School of Public Health, and we have, the co-investigators would be, the principal investigator would be Dr. Suzanne Montgomery, who is a social epidemiologist, as well as the director of our Center for Health Research. The other co-PI is Dr. Sam Surratt, and working along with Seth Wiafe, who are both GIS experts. So we're going to bring in graphical information system software expertise in looking at the point estimates of the air pollution. And then other investigators, Dr. Synnøve Knudsen, who is chair of our Epidemiology and Biostatistics Department, is a physician and a cardiologist, epidemiologist. And then we have Dr. John Morgan, who is the cancer epidemiologist for the Desert Sierra Cancer Registry. Because part of our role in this rail yard grant would be to do a cancer assessment. Dr. Morgan will be leading out on that. Suzanne Montgomery will be leading out in kind of the social part, kind of the non-air pollution, the stresses that these people, that might put them bigger risk for health effects of air pollution. And then myself and then Dr. Rhonda will be helping coordinate the annual meetings that we meet, or the monthly meetings. And so we have a whole team of expertise that will be collecting data, cancer assessment, and then we'll be in the community surveying over several thousand people who live right near the rail yards to see how their self-reported health effects, and see what are their complaints, and how we can kind of coordinate with them and saying how can we mitigate some of these problems.
I'd like to ask you a second question regarding transportation, but separate from the rail yards. There are many busy roadways here in the South Coast Air Basin, and certainly in the San Bernardino and Riverside area. A lot of industry as well. And there are some particular health risks for being in proximity to these freeways. So could you share with us a little bit about what the studies are showing as to the health effects of being right adjacent to these major highways?
Well, there's been several studies that indicate that people who live fairly near, like within 300 meters of a freeway, especially on the downwind side, that the small particulates, what we call fine fraction, the PM 2.5, is quite elevated. The elemental carbon, or black carbon, which is kind of a surrogate measure for diesel exhaust, carbon monoxide, particle count, all of these particulates and air pollutions that are near the freeways are very much affected by the people who live very near that. So the freeways are a major source of carbon monoxide and other road dust. And so one of the effects is that comparing the people who live, a good portion of the population live within a mile of the freeway. And so we want to evaluate how does that relate to subsequent asthma increases, respiratory diseases, chronic obstructive pulmonary disease, all-cause mortality, cardiovascular effects, and there's a whole wide range of health effects that might be exacerbated by living near high sources of air pollution, particularly the roadways.
Dr. Beeson, I want to thank you for joining us.
My pleasure.
For your hard work in increasing our knowledge on the awareness of the public health impacts of air pollution.
Thank you. Pleasure to be here.
Well, that's our show. Thank you for watching AQMD on the Air. Visit cleanairconnections.org to find out how you can help us clean the air that we breathe.
Let's work together.
Well, that's our show for today. Thank you for watching AQMD on the Air. Visit us at cleanairconnections.org to learn how you can help us clean the air we breathe.
Let's work together.